Hi, and welcome to the Soul and Survival podcast with Grant and Louise Bentley. We have run the Victorian College of Classical Homeopathy since 1995. We are both qualified practicing homeopaths, and Grant is also a naturopath. Together, we discovered a link between energy and facial structure based on traditional ideas from homeopathy that have roots going back 200 years. This project is called Homeopathic Facial Analysis, or HFA for short, and has been the cornerstone of clinical diagnosis and training courses since 1999. Between us, we have written and produced 7 HFA books, including Soul and Survival. Soul and Survival is the philosophy of energy influencing matter and how this energy forms individual facial structure, our unconscious drives and fears, our life patterns, and universal time cycles.
Hi everybody, welcome to the next Soul and Survival podcast. Hi Louise.
Hi Grant, how are you today?
Okay, and we're drawing towards the end of 2024 and
we're recording on our holiday.
We are.
Which has mostly been a nice holiday.
Okay, it has.
Nice Christmas, coming up to New Year.
Yeah. Haven't done all that much at this stage, but it's pretty good. Just all the things that needed to be done around the place because, you know, you've got to work at other times. So now just take a little bit of time and try and get a few of these jobs done. So
yep.
Not that exciting, but there you go. That's
exciting enough. That's all good.
Rock and roll in your 60s.
Yeah, okay. Fair enough. Now, what do you want to talk about?
I don't know. You're always the one that asks.
All right. Well, we have done a couple of recordings that didn't record, which sort of throws you a bit because you've had some really good discussions, and we found that our what is it called? The SD card. I'm not sure about the technology, but anyway, wasn't working, so we're starting again, trying again. So what we were talking about, you were talking about how I think it was what patients ask you a lot. And the answer was all around, you know, the difference between an acute and a first aid and a chronic. And these are sort of standard things. So do you want to have a little chat about that?
Yeah, we can go into that because homeopathy is divided into 3 different categories. But one of the things that I'd want to say right from the outset is that remedies are not. Even though we categorise into acute and trauma and chronic, the actual remedies can service all of those 3 areas despite the fact that some books say that that's not the case. I don't agree with that. Simply because I have given remedies like Arnica, which are great trauma remedies, or remedies like Apis, which are great acute remedies, and I've given them both in chronic situations. And I think it's important to point that out because sometimes people get taught or they will read that this is an acute only remedy or this is the chronic off, right? So, I mean, Clark used to do that all the time, didn't he? I mean, pulsatilla was the acute of silica and Belladonna is the acute of calc carb, or you put the other way.
Oh, I forgot about that. Yeah, we learn a lot of those things, don't we?
Yeah.
We learn a lot of things that when I reflect now, because it's a long time ago, it was in the 90s, so we're talking 30 years ago, really. 30 years ago and over 30 years, and so much of that we have let go of, and yet the main principles you've held on to: totality, miasm, the 3 categories of first aid, acute and chronic.
Yeah, and I used to do them. It's not like I just sat down and I was taught this and I thought to myself, well, I just, me and my wisdom of about 6 hours after reading stuff like that, I it's not that I discounted it immediately. In fact, I spent many times where if somebody needed Belladonna, for example, I would look up the chronic of Belladonna afterwards because the way that it was taught was that If you need Belladonna as an acute, then you'll often need calcarb to finish the case as the chronic afterwards, to get you back up on your feet, essentially. So the acute gets rid of let's just say, because it is Belladonna, we may as well stick with that I'm going to assume it's a fever of some form and a high fever of some form. So Belladonna gets rid of that fever, and then you give calcarb when the fever has been reduced, because that theoretically follows on or is the chronic of Belladonna, in order to finish the case, meaning to shorten the recuperation period. I did do it. That's how I can remember Belladonna and calcarb, pulsatilla and silica. I did try them. I don't find it to be of any appreciable
value.
Value, really. It didn't mean much to me. And then later on you start reading, well, Belladonna is the acute and the chronic follow-ons of calcarb or silica or sulphur or whatever it might be. So in the end, I mean, when you've got a wide variety, it doesn't really mean much. That's like sort of, we're back into that, there are 3 miasms. All remedies contain all 3 miasms in varying degrees. So, it's important to be accurate. I mean, that just makes no sense.
It's weird, isn't it? There were a lot of things that on reflection now you think that probably doesn't fit into a paradigm that's useful. Look, it might have been, obviously the author wrote it at the time, and they might have had a particular case where, let's just say, in our miasmatic terms, calcarb is a tubercular remedy, whereas Belladonna is a psychosyphilitic remedy. So the first one is the green group, the second one is the purple group. And so maybe they had a fever and the Belladonna did take the edge off, and then they thought, well, this person needs some chronic treatment. Let's have a look at their total case. And it looked like calcarb, and it probably was calcarb. And they gave them calcarb because they're a tubercular person, although they didn't factor that in, but they just happened to be. And then there's an outcome, and it's really good. So they put 2 and 2 together. But it was really more that a totality remedy affected the fever. And then they've gone in with a chronic remedy that matches the miasm, and it's a good outcome. But they're not actually related.
I often think, though, that we need to cut these people a little bit of slack. They're pioneers. Homeopathy at that stage, if we're talking about Clark, John Henry Clark?
Yeah, I think so.
Yeah, if we're talking about J.H. Clark, I mean, he when he wrote, we're talking about infancy when you're comparing what homeopathy is. When you look at conventional medicine, for example, I mean, conventional medicine if you went back to Elizabethan times or even earlier, you wouldn't even recognise it. But the point that I'm trying to make is that it's been an evolutionary process up until this point.
Yeah.
And everybody has added their little bit, whereas when first you had Hahnemann, then you had Bonninghausen systematising the whole thing. I mean, so when you have things like Clark, you got to remember that it hasn't had a lot of time to evolve. So you got to cut these guys a little bit of slack. They're trying. They're just trying their best. They're just sort of saying, okay, I've seen a couple of cases where we'll stick with the same scenario. So Belladonna has completely drained a person because of the fever. And as a result of that, they end up with, some sort of remedy like a calcarb or a silica to get them back up on their feet again.
Yeah, yeah.
Okay, so the other thing is it's important to label, at least to understand in your own mind as the practitioner what you're looking at. So we're looking at first aid or trauma, and then you're looking at acute, and then you're looking at chronic or constitutional. Chronic and constitutional are interchangeable terms for the same type of treatment. So trauma or acute is when you fall off a ladder or you cut yourself or whatever it might be, a burn, a scald. Anyway, you get the idea. And there are just some remedies that in their proving have been so specific for that encompass the outcome of, say, falling over equals Arnica, that they become as a remedy, Arnica in this case becomes a remedy that you just think of straight away. And in fact, in most trauma, in most of the accidents that involve a blunt instrument or falling to the ground or whatever it may be, usually means Arnica straight away. And that doesn't mean that that's all Arnica does, but it does mean that Arnica is exceptionally good for that. So you would think of that straight away, but you don't have to be an Arnica person or need it. See, when you're dealing with trauma, you're just dealing with one outcome. Whereas when you're dealing with constitutional treatment, you've got to incorporate the person and you've got to incorporate the way that the vital force, that person's vital force, is trying to manage illness.
Would it be fair to say that when it comes to first aid and acutes, it's outside first, then an inside response, whereas when it's chronic, it's an inside response first to the outside? Like, you know what I mean? It's coming from within you. It's much more individualized, whereas with a first aid or an acute, the way things unfold is predictable, whereas when it comes to you as an individual, it's not predictable until you start noticing your own patterns.
Look, you can think of it that way, I guess. I have not thought of it that way. I think what the inflammatory response is the very first response that the body goes into when it's undergone a traumatic episode. But that traumatic episode is often to do with falls and injuries and so on. Whereas when you're dealing with chronic, your body is going into other ways of trying to deal with the problem, because the normal inflammatory reactions are not enough to contain the problem. And that's because it's not a short-term problem. It's usually a long-term problem.
Yeah, I guess, what you're saying is pretty much what I'm thinking in my head. I guess we all have to come up with ways of understanding those differences because our treatment is different. So would you want to talk about that, the way you see the treatment protocol for those three categories as being different?
Yeah, I can do that. So what we can do is, well, when you've got trauma or you've got first aid, you need to repeat constantly and quickly. Because it's a sudden impact on the body. It's a cut, it's an abrasion, it's a fall. And so now what you're doing is that you're, I do anyway, I hit it really hard. So if someone has fallen over or they've got a head injury or banged their knee on a rock or whatever it might be, fallen off a bike, whatever, then I would do Arnica if it's a fall, or I would do, say, either Apis or Cantharis if it's a sting, or Cantharis or Apis arsenicum if it's a burn. So there's different things where you would need to repeat it, say, really about every minute, every 30 seconds to a minute, until the pain starts to die down. Now, what you notice is that it's a short Well, hi everybody, we're back again. Fifth time lucky this time, hopefully, because as you may or may not have worked out, that we only got halfway through podcast 34 and suddenly it all cut out. So we'll try and finish that. And where I was going with that was we're talking about the treatment or the dosing that is different between trauma, acute and chronic disease. And I was talking about how with trauma you need to get a lot of the remedy in quickly because essentially you've damaged the body, you're in great pain, and pain burns up a lot of energy. So in order to get the body back into a state of balance as quickly as possible, we're going to need to put in as much of that energy flow that's going out. And so that's fairly considerable for a short period of time. And so it could be, if it's a bee sting or a cut or a fall, it could be a dose of Arnica or a dose of Apis or arsenicum if it's a burn, and you're going to be doing that about every 20 to 30 seconds, maybe even more until it starts to calm down a little. And then what you do is that you begin to, that 30 seconds starts to just automatically, you just realise you don't need it as much. And so that might go to a minute, and then that might go to 2 minutes, 5 minutes, and then you just think, okay, I've had enough now, and then you stop. So that's essentially the trauma. You got anything you want to add to that?
No, not really. I mean, you'll never really see first aid in the clinic because, of course, it happens when it's most unexpected. So it tends to be something you do in the family home. We do get emails from people saying, this has happened, what do I do? But by the time the email comes through and we get it and you've got a time zone difference and you send a reply, you can lose a day. So the reality is everybody needs to have their remedies ready. You should really carry Arnica with you. And perhaps, you can have Apis as well and maybe some arsenicum, just like a little kit. It's such a small thing to put in your handbag or your travel bag or whatever. And when you have those at the ready, it's just really great to just plug them in straight away, to know what to do with them. It's pretty straightforward. So, yeah, I think it's the easy part of homeopathy.
Yeah, it's the easiest part. Probably the next easiest part, well, not probably, it is. The next easiest part is dealing with acutes. And again, defining acutes. We probably did this last time, but, I've kind of forgotten now because it's been a while and we realised that we only got halfway through. But the definition of an acute is essentially it's got a short duration period. It's got a prodromal period. Prodromal meaning that you're starting to feel a little ill and there's a tug of war between you and the virus, and then all of a sudden you start showing signs and symptoms because you're losing the fight. It's overcome you. And so now you start developing the signs and symptoms that are specific for that virus or that bacterial infection. And so as a remedy, normally what we do there is we also do repeated doses. Now, the good thing about a remedy and acute diseases is that, particularly for the more childhood ones, although you don't see them so often now, but for a lot of these acute diseases, we have what we call genus epidemicus remedies, meaning that if I didn't explain it before, it does mean that they're a remedy or a group of remedies that in their proving show signs and symptoms that are very specific for a particular type of disease. Pulsatilla for measles, for example, or Drosera for whooping cough. So they're always good to have on hand as well. And what you would do there is that you probably not every 30 seconds because you can tell that this is going to go on longer. And you want to make sure that you're right here too. So let's just say it is whooping cough, because there's a fair bit of that that's still going around, unlike, say, the measles or mumps. You don't see very much of that. But now what we're looking at is that you would do a remedy like Drosera, say, every 2 waking hours. So now what you would do is you would reassess after around about 24 to 48 hours. Now, this is slightly different from your average acute, because whooping cough traditionally goes longer than the 7 to 10 days like an average acute does. I mean, can be a cough that can go up to 100 days. In fact, that's what it was colloquially called, the 100-day cough. But we can really get that down if you get the right remedy. Or it can just be a cold and flu, and you can get people over it pretty darn quickly. So normally what I would do is that if it's severe, meaning that the cough was really severe, as well as a high fever, I might do it every waking hour. You never do it during sleep time, because sleep is also a time where you are re-topping up on all of your energy that you have lost during the day. So, and what we're trying to do is top you up with that energy as well. So you would never sacrifice sleep just to get a remedy in. So you would only do it per waking hour, and then again, reassessing in around about 24 to 48 hours to see whether or not there are percentage points of difference. Now, if you're talking about, after 2 days of constant dosing, and you're only 2% better, well, that's clearly not good enough. But if you're 50% better, then all we're going to do is just keep on going with that same remedy in that same manner. If you're only 2% better or 5% better, then after that 24 to 48 hour period, it's really time to change the medicine. And whether it's 24 or 48 will be determined by the severity of the symptoms. The more severe the symptoms, the more you're going to have to be prepared to change the remedy when it's showing itself to be perhaps not as effective as what you would like. Now, what I might get you to do then, Louise, because you do this all the time, is to point out how we do this process of every 1 to 2 hours.
Oh, okay, the rapid dosing. So are you talking about the acute remedy or the chronic remedy for this example? The acute. Okay, so we've actually got a class as part of our course series. It might sound really basic, but it came to our attention that not everybody gets a full education in how to make a remedy, or how to even dose a remedy. And also it doesn't help that a lot of homeopaths have different ideas on this. And the reason that is because the dosing of a remedy is an extremely flexible thing. Basically, you've got to get the remedy into you via water or dry straight to the tongue, where it will be converted into moisture in your mouth. So that's actually not a big deal. People worry about that a lot, but it's the frequency of when you give it. So when we're talking about this every 2 waking hours, the best thing is to take your bottle that you've ordered or been given by your practitioner and take 1 drop of that if it's in liquid, or 1 pilule or pill if it's in sugar of milk form, and dissolve it into a glass or a bottle of water. And then that can take, it's very quick if it's a drop. We like drops because they're pretty flexible and they do dissolve quickly, but you can do the same with a grain or a pilule. Once it's dissolved, give it a shake or a stir with a spoon, and 1 mouthful equals 1 dose. And you just basically repeat that 2 hours later. So set an alarm on the phone, have another shake or another stir, another gulp. That's your 2nd dose, and keep doing that in that way. What that means is you're not dipping into your bottle too much. Now, I'm sorry, pharmacies, for saying this, but you don't need to take a new drop for every dose. You can split that drop. The moment that goes into water, all that water is energized with the remedy, and then you can work from that water. So you can make 1 drop last a day. We do, however, suggest that on day 2 you do make up a new dose, because you're making it in straight water, and water will start gaining bacteria if it's not refrigerated for a day or two, and even then it'll start growing bacteria, or it doesn't have some alcohol in it to, sort of kill it and preserve it. So we just suggest make up a new dose or a new batch the next day if you need to do it for 2 or perhaps 3 days, which sometimes you do. But it's a really effective way of dosing, and you're getting the remedy in and you're giving your body the frequency that it needs. That's probably about the best explanation I can give for rapid dosing.
Yeah, and I don't know, on one of the podcasts that we did, we were talking about how the laws of energy are completely the opposite to the laws of material matter. And I don't know whether that ever came across.
Well, the problem is, as you've already mentioned, we had a recording failure. So we did a few recordings and then discovered they'd failed. So now we can't remember what we've recorded and what we haven't. It could even be in next week's where you did speak about that. Yeah, I'm not sure.
Yeah, look, I don't remember, but one of the reason that I'm bringing it up is by putting it into either a water bottle or a glass of water. People will often say, well, isn't that diluting it? And what we're looking at when we deal with energy is that if you deal with another energy, for example, like electricity, and I often give this example with people, that if you go up and if you've got a 50-volt fence, a farmer's fence to keep the animals in, and if you touch that 50-volt fence with one finger, you get a 50-volt shock. You touch it with 2 fingers, you don't get 100, you get a 50-volt shock. If you put all 5 fingers on it, you still get a 50-volt shock. But you do get a 50-volt shock every single time you touch it. The other thing so repeating a dose means that every time you take a sip, you're going to be getting that 30C every single time. The other thing about it is that when you're dealing with a confined area, and remember it's got to be a confined space, but when you're dealing with a confined space like a bottle in a remedy or a bathtub, I don't know why you'd put a toaster in a bathtub, but if you put that
You definitely shouldn't.
No, you definitely should not, because every single drop of that is, in our language, I don't know the voltage of America, but in our language, it's a 240 volt. You stick just the tiniest little part of your finger into that bath and zap. So when you put the remedy into a water bottle or you put that into a glass, that 30C is in every single drop, right? So you're getting it every time.
Which is incredibly energy efficient when you think of it like that. I mean, homeopathy is the most environmentally friendly form of medicine or energy treatment, health promotion that you can possibly find. It's extraordinary because you can make so much remedy from one bottle. You can extend a bottle out. And we do say this to patients, obviously, when they get toward the end of the bottle, look, if they've only got a week to go and it's looking a bit low, you can extend it a little bit, and that's fine. And so these are the things we teach, because there's a lot of almost secrecy around the dosing, and it does, patients get very upset about the fact that one homeopath tells them this, another homeopath tells them the other. Some make such a fuss about the number of drops or the number of grains, when really you're just wasting your remedy. If you give more than one drop at the same time, you've just wasted the remedy. You haven't doubled it or made it better. You've given in exactly the same dose, you just used more of it to do so.
You know that term rookie mistake? I think focusing on dose, or what is homeopathically called posology, which is essentially just dose, how much to give and when to give it. So, but posology becomes this, I think when you're a rookie, when you're just a beginner, it becomes the most important of the hierarchy of different aspects of what goes to make up homeopathic practice. But it is a rookie error.
Well, it's because we can't stop thinking in material terms, and everybody thinks the quantity matters. You know, the quantity of water, the quantity of drops, the quantity of grains. Is it grains or is it drops? Doesn't matter. They're just a base. The energy is put on the base. Now you're delivering the energy to your body. Water's a good way because, as you pointed out with your electricity analogy, the energy travels pretty quickly through water. Water's a wonderful medium for energetic transference of information. So we might as well use the water. And most people are happy to take a drop no matter what. And it's just such an easy thing to do. So we do advise, if you're going to be having the choice of which you order the drops, because they're really user friendly. But of course, some children love the sugar taste of the sugar of milk pill. So if you're finding, they're not going to take a drop, or they won't even drink a mouthful of water, then, get the pills. It's fine.
The other thing too, I think that you can do is that with some kids, they get a little recalcitrant when it comes to taking remedies, and they just don't like it. And so you can always put it in drinks, soups, and you can put it on food too. I mean, some people will sort of say, well, is that ethical to be doing that? But my answer to that is absolutely. When you're dealing with a minor and a minor that's sick, they're not in a position to be able to understand what it is that you're trying to do. And so, yes, you do have to take control, and sometimes that means you have to surreptitiously hide it. So now you've got this thing of, well, you can't put it into food and you can't put it into soup because I've read that. Look, again, that's just another thing where I'd say that's just not true. I've had people put it into coffee. I've had, particularly when you're dealing with conditions like pandas, for example, for a long period of time, these kids are not compliant. It's part of the makeup of the condition that they're just going to be compliant, and they're just defiant in everything that you try and do with them. And sometimes you've just got to surreptitiously do it.
Yeah, of course. And if you think of it, that delivering a remedy to the body is delivering a positive message, because it's true. There is nothing chemical left in there. It's true. You can't see it under the microscope. So, all the naysayers are actually, saying a fact. But that doesn't mean there isn't something in it that works. And what's in it that works is some form of energetic communication. Now, you wouldn't say to a parent, oh, you should never tell your child you love them because, that's a message that might mess them up. Wait till they give you permission to say it. Of course you wouldn't. You're the parent. You get to give the good messages, and homeopathy is just a good message to the body.
Yeah, and they're just not in a place to be able to make those sort of decisions. So I have no problem with that. But by and large, if we're just dealing with the topic of dose or posology, I think that we've probably just about summed it up.
I think so, and we've already recorded the next one, so hopefully, if there's a bit of a glitch in time, you'll get you'll understand what's going on. But next week, you start to you do a bit more on the acutes and about resonant energy. And then you go into memory and muscle memory and so forth. So it's pretty interesting.
We've already done that, or that's what we're going to do?
No, we've already done it.
Oh, well, that was an interesting podcast.
Yeah, didn't that go well?
I'm glad everyone enjoyed that one.
That was an easy one. No, not really. We've had a lot of technical problems, but we're doing our best.
All right, well, we'll see how we go, and we'll speak to you all next time. Okay, bye-bye.
Thanks, Grant. Thanks for listening to Soul and Survival. If you are interested in more information, books, courses, consultations, learning more about facial analysis or life themes, please visit our college site, Victorian College of Classical Homeopathy, vcch.org.